I'd like to think of formula and breast milk not as good or bad, but more as okay and better. Are you pregnant right now and deciding between breastfeeding and formula feeding? Are you conflicted because healthcare professionals really promote breastfeeding and you don't want to be stuck and feel a sense of pressure or have your feeding choices affect your career? You're in the right place. In this video, not only are we going to compare how these feeding options affect your baby, we will also comprehensively compare how it affects you, your lifestyle, sleep, health, mental health, and things around you. Let's begin by comparing the content within breast milk and formula. This picture from Milkology is a decent representation of content in breast milk versus formula. Breast milk has antibodies to protect against illnesses. There are hormones in breast milk that can promote bonding and regulate the baby's appetite. Stem cells in breast milk can provide organ development and organ repair. The long-chain fatty acids can aid in nervous system development as well as eye health. Enzymes in breast milk support the digestive tract as well as their immune system. The nucleotides and hormones can all help baby develop a healthy sleep-wake pattern. These ultimately provide a protective factor for newborns to optimize their brain development and their immune system. Formula is designed to mimic the contents in breast milk. However, it will overall have less variety. But you didn't click into the video for me to give you a lecture about this, so let's talk about how your feeding choices may affect you. Breastfeeding is found to reduce your risk of breast cancer, ovarian cancer, heart disease, and type 2 diabetes later in life. Making breast milk also burns up to 500 calories a day, so mothers who breastfeed are more likely to be back to pre-birth weight by around 9 months postpartum compared to formula feeding mothers. Bone density is something that will be temporarily decreased during pregnancy as well as breastfeeding. Research shows that it can typically be restored after weaning and is not associated with osteoporosis later in life. Some research also suggests that although pregnancy itself may lead to bone density loss, however, if followed by lactation, it will provide protective effects on bone density, while the duration of lactation and parity may modulate its effects. Number 2. As you release oxytocin during breastfeeding, breastfeeding is found to enhance bonding and attachment. Hormone exchanges during breastfeeding can foster emotional connection, trust, and attachment between the mother and the newborn. Skin to skin and baby suckling releases oxytocin, which is the love hormone, to help you form an unbreakable bond with baby. However, some women find breastfeeding very painful, especially when there's existing nipple trauma. Sometimes not being able to establish breastfeeding may cause significant stress and increase the risk of postnatal depression. Number 3, sleep. Some research has found that overall, breastfeeding mothers result in better quality sleep than formula feeding mothers. However, this sleep will seem less like a routine, more like needing to sleep when the baby sleeps. Some studies report decreased sleep quality for formula feeding mothers. Number 4, lifestyle. It is way more cost-friendly and saves the time of making formula, storing formula, feeding equipments, and sterilization. When you're traveling on a plane, you do not need to anticipate or spend time to prep a bottle when you can just put baby on the breast and give baby comfort through landing and taking off. Breastfeeding is also way more convenient during any global pandemic, such as COVID, when there are shortages of food or clean water, when there is flooding, when there is potential water contamination. During the Alfred cyclone in Brisbane, a lot of places lost power for 3-4 days, so not having access to clean water, being able to use sterilizing equipment, and having to boil water with a gas stove versus a usual kettle can cause significant changes in your daily routine. In war-zone countries where people cannot leave a certain area for supply, breastfeeding can truly save lives. For mothers who struggle with their milk supply and their milk production, they may need to breastfeed, pump, and top up with formula, which is really time consuming and can affect their overall lifestyle. If you're put on a plan to triple feed, please look after your own mental health. Just remember that a plan to triple feed will always be temporary to help you achieve your feeding goal. However, if that's not working out for you, please speak to your local lactation consultants, child health nurses to see what works for you and your lifestyle. When you're traveling, having access to clean water really requires preparation to plan for each feed to make the formula as safe as possible for your baby. The last thing we'll touch on is environmental factors. Breastfeeding has no carbon footprint and reduces the cost of hospital admissions and healthcare-related costs for both mothers and babies. And these hospital-related admissions and healthcare costs not only last for the short term while you're breastfeeding because of the protective factors and the long-term health benefits breastfeeding provides for the baby, it can also impact how healthcare works in the long term and the overall health of our population. Formula feeding compared to breastfeeding has environmental factors where it produces more plastic waste, as well as the running cost of equipment and upgrading bottles and teats as baby gets older. Now, for the baby, breastfeeding is more than just food. It has lots of protective functions against different types of infections. These include gastrointestinal infections, atopic diseases such as eczema and asthma, middle ear infection, urinary tract infection, and respiratory infections. It can also prevent certain childhood cancer, reduces the risk of sudden infant death syndrome, and decreases the relevance of obesity, type 1, type 2 diabetes later in life. Babies are less likely to be hospitalized for illnesses and infections. They have enhanced dental and muscle activity around the mouth and the palate. Breast milk changes from feed to suit each baby's unique needs for its optimal growth and development. So why did everyone promote breastfeeding? World Health Organization recommends exclusively breastfeeding for the first 6 months of a baby's life. So I guess to sum it up from everything that I know, breastfeeding is recognized to be the single most preventative intervention for global health, as it has long-lasting physical and mental health benefits for our future generation. However, I believe we should also use a risk and benefit approach to promote the overall well-being of both mothers and babies. Ultimately, we just want both mothers and babies to be healthy, because a happy mother equals a happy and healthy baby. There's a huge spectrum of options available, from exclusively breastfeeding to exclusively formula feeding. I'd like to think of formula and breast milk not as good or bad, but more as okay and better. Research has proven that infant growth in the first 2 years of life significantly affects how their brain evolves until they're 10 years old. This means that weight gain is directly related to a baby's brain growth, which can affect their IQ, their neurocognitive and behavioral functions, their learning abilities, communicating skills, and much more. In my opinion, a baby who is fed with formula and putting on weight as expected and has a happy and healthy mother, they're going to thrive more than a baby that is not having sufficient breast milk and not putting on weight and not meeting their caloric needs for their brain development in the early years of life. So ultimately, finding a balance of a feeding option that works well for both the mother and the baby is the most important thing. I would like to wrap up the video with a quote from a breastfeeding mother and a quote from a formula feeding mother. This breastfeeding mother says, "I chose to breastfeed because breastfeeding is the best option for me. This is my third son. My first, I gave the bottle and I noticed he got sick a lot. Nothing too bad, just a lot of ear infections, colds, things like that. He also had colic for a while, so I was switching formula a lot. My second son, I breastfed. My midwife said that maybe if I did that, he would not get sick like that. He's almost 8 years old now and is almost never sick. So I think breastfeeding is the way to go. I wish Stu would have told me about this when I got pregnant with my first. They just asked me how I was going to feed the baby, and I said bottle because that was the only way I knew about." This formula feeding mother says, "When you bottle feed, you know the baby can go anywhere you want. The father or grandparent can keep him so you can go and get your life back and get some sleep if you're tired. I don't think it's good for a mother to feel like she has to plan her life around her baby. All that does is spoil the baby and stress out the mother. The mother, has to live too." Now, that brings us to the end of this video of formula feeding versus breastfeeding. I would just like to clarify that I'm not telling you to breastfeed and I'm not telling you to formula feed. I want every mom and baby out there to find a feeding option that works the best for them. So have a think, do some research, talk to the people around you, and I trust you to make the best decision for you and your family. See you in the next one.